Hi, and welcome to another edition of Unfiltered Productions. Boy, do we have some great information for you guys today with a couple of great ladies. One Dee Kornetti, who is an owner founder of Kornetti and Krafft. Obviously, Dee Kornetti and Kornetti. And joining us today is Sandy Decker. She's the Vice President of Home Health Regulatory and Clinical Affairs for AHHC and SCHCHA. Wow. That's it. And hopefully she'll tell us a little bit more about what she does, but I know she has a history of working as a CGS administrator. And CGS is one of the fiscal intermediaries that work in home health that help to regulate how we get paid by Medicare. And we have some burning questions, guys. Thank you for being on here this morning, this afternoon, whatever time of day it is.
Oh, my pleasure.
Good to be here.
One of the two hot button situations, we have a lot of information coming out of the news about sequestration and whether or not Medicare sequestration is going to move forward as of tomorrow or if it's been delayed. I'm wondering, Sandy, do you mind just explaining briefly what sequestration is and where it stands right now?
Sure. As Sherry and Dee and I were discussing just a little bit here before we hit the record button, we kind of all think that sequestration is a very confusing word. And what the whole project means is affecting the Medicare payment. So a bill has passed through the House and also the Senate, but they're not exactly the same. So there's still some fine tuning, some finessing, probably arguing, knowing it involves politicians, but we just wanted to bring that topic to the forefront a little bit today. Dee and I aren't going to delve in it very deeply just because it's not 100% for sure, and we don't want to give you any confusing information that might muddle the water. So that will be information that will be presented from several different sources when it does become finalized. And I know that you have information to reach out to Dee and Sherry can also pass out in a follow-up email what my contact information is. If after all this becomes official, if you have any questions or would, is there's any way at all we can help. So I hope that didn't just raise more questions, but did want to acknowledge that it is happening.
Thank you, Sandy. The thing that we want to talk about is what it is not. We've been through a year where a lot of things were put on hold, a lot of dates were pushed back, and I'm talking about the RCD demonstration. I'm talking about audits, surveys, all those kinds of things. We had a lot of changes in 2020. Some of them extended into 2021, and I'm wondering if one of you guys would briefly discuss what is going forward right now and what has started again and what is still waiting. You guys choose who goes.
Well, I'll start with that one if it's okay, Sandy.
Of course.
And talking about the review choice demonstration for home health services, I'm looking back to when we got a notification last July, actually July 7th, that there was a resumption of demonstration activities, an update that was provided. And they said that they're going to kind of discontinue exercising, CMS was, enforcement discretion for the RCD for home health beginning on August 3rd, regardless of the status of the public health emergency. And so they were going to start into those initial selection or choice selection periods for North Carolina and Florida last summer. And so since that time, we've had updates again in August with a phasing in of the RCD in North Carolina and Florida, and that continued with updates at the end of October and even up right until late December of 2020, where we're still having this phased in participation in RCD, where providers may continue to submit pre-claim review requests, Claims that go through pre-claim review with a valid UTN will be excluded from further medical review, and claims submitted without going through the pre-claim review process as of December 2020 will process as normal and not be subjected to that 25% payment reduction. However, there is a statement that these claims may be subject to post-payment review in the future through normal medical review processes. So they're not going to be captured on there if you don't elect to have an RCD, a pre-claim review, right? A review choice prior to it and establishing a UTN, then you automatically would have those claims reduced 25%. That's not what we're hearing. And so we kind of have all this stuff with waivers going on, with the extension of the pandemic several times now, probably through the end of the year, according to the current administration, but not necessarily all the Health and Human Services mandated writing of these extensions. And so I think we're really up against a deadline for the end of March as are these things going to be formally extended, legislatively? And if not, what is that going to mean? And are, all of these external auditing agencies and even the MACs, with review choice, Palmetto, are they going to be sitting there chomping at the bit, kind of in a release the hound sort of mentality? Sandy, you have any thoughts on that?
I love the release the hounds mentality. And everything Dee has mentioned is completely accurate. If you are listening from Florida or North Carolina, last week, towards the end of the week, because everything seems to happen last minute, CMS did announce that the RCD program for North Carolina and Florida was going to continue its voluntary basis.
Mm-hmm.
And Palmetto, as our MAC, as with other MACs, has their hands tied as far as what information they can give out. CMS is very picky about all their regulations and what they can and cannot do. But from what Palmetto was able to give me just vaguely is that providers are doing a great job of going ahead and participating in RCD. Everyone seems to have signed up for the choice that is the most appropriate for them, with by far being the pre-claim review, where everything is looked at prior to the payment and you don't have to, excuse me, furball, you don't have to reimburse anything. Now, that being said, this is at this point is a voluntary program, but everyone is being encouraged to participate. Now, at first, it did sound very scary. Every single claim you have is going to have eyes look at it. Are all the dots, are the I's dotted, the T's crossed? But once people have gotten into it, what I've been hearing back is that it isn't that scary. And the providers did really appreciate finding out what they were doing unknowingly incorrectly. So, if you haven't already started with RCD, I would encourage you to. If you have already begun it, I hope it's working well for you. And I'm always glad to be here to answer any questions, because as Dee and Sherry well know, you think you've provided everything you need to for education to be prepared. But then when you actually get that feet on the street and trying to figure out the details, sometimes it can be confusing.
Absolutely. We also had an announcement last week on the 16th, which was last Tuesday, I believe, Tuesday a week ago, about the RAC, the RAC audits returning. And one of the things that was interesting in that post was that they're going to only audit those claims 3 years back prior to March of 2020. It looks like they've made the March 2020 to March 2021 and sort of an outlier or set aside. Doesn't mean that they won't go back and look at that additionally further in the future. It just means that right now they're only going prior to March 2020. What do you think that that's going to show them as far as, since we started PDGM in January, on January 1st, 2020 to March 2020, what do you think they're going to be looking for?
Well, here's the thing. The pandemic is just made an entire amount of the data that comes in an anomaly unto itself. And so we see that with some of the rules that have come through that lead us into 2021. There's very minor changes. This continuing with the, we're going to monitor telehealth, but now we see information coming out related to telehealth may be one of those areas that is going to be a site for audit. So the idea is that we didn't have a lot of time in PDGM, but anything that happened since the declaration of the pandemic has really kind of taken it off the paper. At least that's what we're seeing. So we're really in a data blackout, if you think about it, because a large percentage of what we had hoped to get after a couple cycles, right, a couple 60-day periods in home care under PDGM to start to refine the current payment methodology according to some of my contacts at the Medicare administrative contractor level, is that we don't have that information because we've eliminated that. So people that may have been on for 1 or 2 30-day episodes, we don't have a sufficient amount of data, at least CMS didn't think they did, to refine the 2021 rule or to do anything. Now, that takes us a little off your RAC question, but what that means is that you go back to what you know, right, Sandy? You go back to RAC being an external auditing organization that is looking for you to abide by the regulations as laid out in Chapter 7 under the Medicare Benefit Policy Manual for the delivery and the coverage of services under the Medicare benefit. And so we have to hold tight to that, because I think we're going to start to see some of these things that poke up, like the telehealth, some of these other things that come forward. But ultimately, it's the tried and true, the same things that we've always been held accountable, because the things that get you paid in home care haven't changed. Any thoughts?
Go ahead.
Thanks, Dee. Those are some great thoughts and some clarifications. When we're looking at the RAC audit, remember that the RAC stands for Recovery Audit Contractor. And if you want to, you can always go to the cms.gov website and just put in home health RAC, and it will take you to a page that explains it and goes into much more depth. Now, the difference between RCD, which is Review Choice Demonstration, and RAC, which is Recovery Audit Contractor, we have to have so many acronyms in this business that we get lost, but excuse me. The Recovery Audit Program, people get moved to that generally because their MAC has recommended it. There also can be other things that will kick it off, but it's a program that looks a little bit more into depth as to far as what's going on with your documentation. Is there something that's kind of setting you apart from your peers? But that's the difference between the two programs. And it is possible to have both come up on your radar at the same time. But if you are in RCD and the RAC raises their hand and you have caught their attention, then you will be removed from RCD. You don't have to deal with both at the same time. That's way more of a headache than anybody should have to deal with.
Sandy, I cannot agree with that statement more. That is a big headache to have to deal with. And with still recovering from the pandemic, agencies are strapped with staffing and PPE and how to deliver things in a highly infectious environment. I think we probably need to end this podcast here, but I'm left with a question. I'm left with a question of what should agencies get prepared for now? And I think we're going to probably do that in the second part of this episode. Second part of this podcast. So I wanted to thank you guys very much for joining me and joining us on Unfiltered Productions. And we'll be back with more information on this subject, on this topic that is very important to agencies. Thank you guys very much for attending, and we hope to see you again soon.
Thanks.